Hi, my name is Reza Moein Taghavi, and I'm currently a fourth-year medical student at UC Davis in Northern California. Before medical school, I used to work in biotech in the tech industry, and that was when I realized I had an interest in the tech side of things as well. And now in medical school, I've been trying to apply my background in tech to medicine to create solutions to improve patient care, health equity, and outcomes. In terms of patient education, at UC Davis at least, we have created a chatbot that improved the rate of COVID vaccination in patients from underserved communities. And that is a real-life example of how AI is used and can be used to improve patient care and outcomes. And there are multiple other examples of such things happening across the country as well. Yeah, currently, in terms of diagnostics, something that I noticed is that there are algorithms that are being developed, at least in the field of radiology, that, for example, help with the detection of nodules in CT scans, or for patient triage. For example, if there is a CT scan of the head that is of a patient who was in an accident, the AI can go over it and detect if there's an hemorrhage in there and puts it higher in the queue to be read by a radiologist. So these are some of the examples where AI is being applied currently. Yeah, in terms of challenges of implementing AI, the very first thing is the trust of patients. And it's because patients sometimes don't know what AI is and if their data is being secured, or the privacy aspect of it is very important to them. So I'd say that's the main aspect of it, the patient's amount of trust in the system. And also, given the new reports coming out from generative AIs, hallucinating data and making up stuff, that's another aspect of it that is kind of challenging at this point. But moving forward, I'm optimistic that we can create solutions to improve the results and the data that these algorithms produce. For example, at UC Davis, we have created a consortium called Valid AI, where we are trying to validate the data that comes out of the generative AI algorithms to make sure that in the future, if those algorithms are used for patient education, they give them reliable and correct information from reputable sources. For patients, if you want to address the patient's hesitation for using it, I think the best way is to just show them how the system works and how it can really help them answer some of their basic questions. And these are the systems that are being currently developed, and in the future, in the next decade or so, I can see them being implemented in patient care. And some of the studies have already come out saying that patients prefer the answers coming from, for example, a chatbot answering their questions, because a chatbot has more time and resources to answer the questions versus a doctor who is very busy seeing patients and also has to answer to 20 mailboxes that come to his or her way every day. So I think the quality of these algorithms and the showcase of them and just demonstrating that to the patients is going to be really effective in convincing patient populations that they can be a reliable source of information for them that they can use in the future. AI can play a very important role in personalized medicine. One of the things that comes to my mind is the genomics area, where there are huge data sets that can be analyzed that can link the genes of patients to various diseases. Another area that is in the field that I'm going to, radiology, is radiomics, where AI is being applied to extract more features from imaging data, such as tumor characteristics and shapes that can correlate with the pathology of it. So when it comes to AI, because it has the ability to consume and analyze a huge chunk of data, it has the ability also to see the patterns that sometimes it's very difficult for us humans to discern. And I think that's going to play a huge role in medicine moving forward. When it comes to ethical considerations, there are a lot of data breaches that happen like every day almost, that you hear about on the news. So it's I think that's the very top aspect of it, the privacy aspect of patient data and information, that is very important for us as both medical professionals and the society moving forward, to make sure that that aspect of patient data is protected. Another aspect of it is biases, and this goes back to the data that you use to train the algorithms. If you train a data set that is diverse and accounts for various patient population, you mitigate the chances of bias happening in the training of the algorithm and the results that it produces. So I think those are the main two aspects of it, bias and privacy. So when it comes to improving patient care in rural areas and patients from underrepresented communities, I think AI has a very important role that can be further explored. So far, I've seen examples of telehealth companies that are using AI to better do to perform triaging of patient care, and also to collect data and analyze the data and have that data readily available to the physicians, so that instead of having the patients go to the physician's office to be seen, the doctor can monitor the patient remotely. So I think those are the main aspects of it that are being explored right now. But in the future, I can see that we can create remote or digital hubs where patients can go in there and have their vitals taken, like automatically, all of this, and blood samples taken and all of that data analyzed, and that being sent to physicians. And then after that, the physician can decide whether the patient should go see them sooner or later, etc. So I think the future is going to be very interesting in that regard, and I'm really excited about it. When it comes to machine learning and natural language processing, especially with the advent of the large language models such as chat GPTs, there is a huge potential for improving patient care and education. When it comes to care, patients can reach out to their doctors via email or text messages, and if the questions that are being asked is simple enough, instead of the physician trying to answer all of the questions or typing everything, the LLM or the large language model can pre-write these answers, and the doctor can approve it and have it sent. So that's one aspect of it. And then when it comes to education, when it comes to patients who are from especially low socioeconomic background, a lot of times the issue is that they don't know what they don't know. And these large language models have the potential to really improve that. So for example, if they don't know there is a shuttle service from this clinic to a place close to their home, they can find that out through chatting with the chatbot. And a lot of this information, although they might be available on Google, but it takes a lot of digging to find that information. And when it comes to patients who don't know much to begin with, I personally believe that these large language models, such as ChatGPT, but the medical version of it, have really the potential to help patients and really improve health equity. In the next decades, I think patient education, again, is going to be very big, especially because nowadays the primary care doctors are inundated by messages that they receive from patients, and on top of that, they need to see patients. So in order to help the primary care doctors, if we develop large language models that can either answer some of those questions or pre-write them, that's going to be very helpful to primary care doctors and also reduce their burnt out rates. And on top of that, in terms of diagnostics and personalized medicine, I think that's another huge area. Again, I'm going into radiology, so I'm a little bit biased in that regard. But in terms of diagnostics, for example, there are going to be many algorithms applied to imaging data that can help radiologists improve their speed and efficiency in terms of reading scans, and for personalized treatment and preventative care, for example. And also, algorithms can be really helpful in analyzing the electronic health records of patients to find patterns and recommend treatments. For example, if there's a spike in a patient's cholesterol, the patient can be contacted by the ChatGPT equivalent of a chatbot that can recommend them various lifestyle changes and diets and resources in the area that they can use. So I think in terms of diagnostics, personalized care, and also patient education, we're gonna see a huge utilization of AI in the next decade.